Idaho's bill to outlaw medical treatment for transgender kids is now heading to the House floor after passing the House Judiciary and Rules Committee 14-3. But not before the bill went before the public. A packed House for that hearing on House Bill 71, which would add transgender treatments like puberty blockers, hormone therapy, and gender-affirming surgeries for minors. It would add those things to Idaho's already existing genital mutilation of a child law. We heard from Republican Representative Bruce Skog, who is sponsoring the bill, who split his time with Blaine Canzati of the Idaho Family Policy Center, who obviously helped draft this bill. And we heard from several doctors in the state and otherwise who spoke both in favor and against the bill. Those doctors in favor spoke about a child's confusion when it comes to their gender, about how their dysphoria can be treated with just straight therapy, no pun intended. And they spoke to the permanence, I should say, of puberty blockers and hormone treatments, which I would assume is kind of the point of taking them, right? Those doctors opposed to the bill, well, they stress the need for such treatments for trans kids to help with their mental health and eventually their physical health as a way to avoid self-harm. They also said that 99% of physicians in Idaho are there to provide the best care possible for their patients, and lawmakers should stay out of the decision that should be between parents and their child's medical doctors. There was a common take among those in favor of the bill that these treatments, the hormone and puberty blocking treatments, are irreversible and go against what Representative Skog called the fundamental right to procreate that would be taken away by these parents.
It's a massive cash grab. The FDA has finally admitted to some of the long-term effects that these practices can have on children. Puberty blockers have been known to lead to swelling of the brain and vision loss, loss of bone density and muscle mass, and even sterilization. Yes, they're sterilizing children and giving the false promise that it's just simply a pause on puberty and can be reversed. These are claims that have been proven false repeatedly.
I have transgender patients over the age of 18 who have been on cross-sex hormones for more than 2 years, and they discontinued those hormones for a period of time in order to regain fertility and have successful pregnancy, both male and female. And the evidence is quite clear that puberty blockers do not shut the door on fertility.
A majority of gender dysphoric patients carry mental health diagnosis. Many have been sexually abused. I can testify that medically altering their physical appearance is not the answer. As a doctor who has sworn to do no harm, it is my duty to warn you against gender treatments that fundamentally alter a child's healthy body. These therapies sterilize children and do not address their underlying trauma. It would be considered unethical to perform a gastric bypass surgery on a child with an eating disorder.
The fear of being fined, jailed, or of losing my medical license for providing the well-established, safe, and medically studied standard of care for my patients is highly concerning to me, and I have considered looking to other states and other areas to practice. I strongly recommend that you reject this bill and to protect Idaho's future physician workforce and the rights of parents to make medical decisions for their children.
That idea of kind of moving somewhere else, well, Dr. Schwer said she's heard the same sentiment from several other doctors, either already in Idaho or considering moving to Idaho. There was also passionate testimony today from people with actual skin in the game, parents of transgender teenagers and transgender teenagers themselves. Chris Hunting is a transgender person raising a transgender teenager. They grew up in Idaho and told the committee there were countless times they were made to feel not wanted or that they did not belong here.
I'm here today to ask you to please stop bringing things like this here. My kid doesn't need to feel the way I've felt here. My kid deserves to be here.
Let's stick to the bill. Let's just talk about this, doing the surgery on the kids.
Absolutely. As an Idaho resident and an Idaho parent, it is my right to have medical discussions with my kid's doctor about their health care. And I've seen many of you stand adamantly against the government getting in the way of parenting. Confused as to why you're here trying to pass it today. Transgender youth belong here just as much as cisgender youth do. They need to know that. They need to know that they're loved, and passing legislation like this makes them know that there's a whole committee of you that think they're not.
This bill is nothing more than an attack on the most vulnerable of our kids, are transgender kids. This culture war has no place in the Idaho legislature.
Okay, let's stick to the bill, right?
This is part of the bill. House Bill 71 has one purpose only, and that is to prevent kids from getting life-saving medical care. I am sticking to the bill.
Okay, we are out of time for you too, so.
Well, let me just ask you this one thing, please.
We'll let
I
you wrap
implore
it
you
up.
as a mother, leave our kids alone. Let those decisions be with their parents and their doctors, not this body of people and not the Idaho
I
legislature.
appreciate your passion.
Thank you.
Thank you so much.
So you can kind of sense the theme there and the passion as well. Opponents wanting these decisions to remain with the family and their doctors. Okay, so what about an actual transgender teenager? Well, when 17-year-old Eve Devitt stepped to the podium to explain how being on estrogen for almost 3 years has saved her life, making her more complete, Representative Chris Mathias wanted her to walk him through the process.
It took probably about 9 months to a year after that to actually get on puberty blockers, because I had to go through a bunch of different psychological evaluations and stuff like that to make sure that it wasn't, that me being trans wasn't because of a traumatic experience or depression or anything else like that. And then from there, it took probably another 6 months of getting tests done, getting labs done, going to therapists, all that stuff, endocrinologists, to get onto estrogen. I am sick and tired of seeing the people on this committee constantly try to take away my rights every single year, but I'm not tired of fighting back. If you care about the rights for parents to choose what is right for their kids, like you stated you had just earlier today, then you will vote against this bill.
Eve says she's going to get a consultation for surgery, which will still not happen for at least another year. Point is, this isn't the very next step for teenagers who come out as transgender. In fact, a lot spend years in therapies, you just heard, before making any life or gender-changing decisions, and some don't even make that decision. Representative Julianne Young said at the end of the hearing today, the state of Idaho does set some limits on parental rights. That's what Idaho does, setting some limits on parental rights. Unless, of course, it comes to those parents in the name of religion who do not want to give their kids medical care. With this whole thing, they're not even sure how many Idahoans are going through gender affirmation treatment because we don't track this stuff in this state. We do know experts put the number of those with regrets who go through this at less than 1%. So they don't know how many they might help with this bill should it pass, but based on testimony today, they do know how many it would hurt.